Bismillahirrahmanirrahim. Assalamu alaikum. In this video, we are going to discuss direct acting cholinergic agonist. So there are many drugs that can activate the cholinereceptors. These drugs are known as cholinergic agonists because they mimic the effects of acetylcholine, and they either partially or almost wholly resemble the pharmacological action of acetylcholine. So depending upon their mechanism of action, the cholinomimetic or the cholinergic agonist drugs are divided into two types. One is direct acting cholinomimetic and the other one is indirect acting cholinomimetic drugs. Now further, you have to keep in mind that cholinergic agonists, they are also classified on the type of cholinergic receptors they activate, whether they activate the muscarinic receptors or the nicotinic receptor or both receptors. By direct acting drugs, we mean that those cholinergic agonists that directly combine with the acetylcholine receptors and act as agonists of the acetylcholine receptor. You have to keep in mind that all the direct acting agents, they have longer duration of action as compared to acetylcholine. And further, the muscarinic agonists, they are divided into two groups. One is the endogenous choline esters that includes the acetylcholine and synthetic esters of choline. Its example is carbachol and botanical. These are the name of the drugs that are in this group. And the other group is the naturally occurring alkaloids, which includes nicotine and pilocarpine. So the cholinergic agonists, they could be selective or non-selective. By non-selective, we mean that they bind with both the muscarinic and nicotinic receptor. And by selective, we mean that they either only bind to muscarinic and they are known as muscarinic agonists, or they only bind to nicotinic and are known as nicotinic agonists. So keeping in mind this concepts, now we are going to discuss about acetylcholine. So you can see in this figure that direct acting parasympathomimetic drugs, they directly bind to the acetylcholine receptor, just like the original acetylcholine mechanism. You have to keep in mind, students, that parasympathomimetic drugs or cholinergic agonist drugs or cholinomimetic drugs, all of them are the same. They all have the same meaning. So starting with acetylcholine, this is the structure of acetylcholine. It has an acetyl group and a choline group. Acetylcholine is not lipid soluble in nature and hence it cannot cross the blood-brain barrier. So acetylcholine, actually it is the physiological neurotransmitter at the autonomic nervous system ganglia, and it is the neurotransmitter of both the parasympathetic and somatic nerves as well. So that is why, due to this reason, it lacks the therapeutic importance due to its multiple actions and diffuse effects. Also, its short duration of action is due to the fact that it's very rapidly inactivated by acetylcholine esterase, as you can see in this figure. And acetylcholine is non-selective in nature. It means that it acts on both the nicotinic and muscarinic receptors. So now we will discuss the major pharmacological actions of acetylcholine. As we know that acetylcholine is the main neurotransmitter of parasympathetic system, so definitely its functions are very similar to what is actually happening in the parasympathetic system. So we look at this figure while discussing the major pharmacological actions. So first of all, we will discuss the pharmacological of acetylcholine on the heart. So when acetylcholine acts on the M2 receptor, you have to remember the location of the receptors on the organs. The heart has M2 receptor on the SA node and AV node, and as soon as acetylcholine it interacts with M2 receptor, it causes decrease in the heart rate, which is known as bradycardia, and by acting on the atrial muscles, it decreases also the contractility, so it decreases the heart rate and contraction. So the major effect of acetylcholine on the heart is on the atrial muscles, and it has very poor effects on the ventricle. So the action of acetylcholine on the heart is similar to that of the vagal stimulation. And the next major pharmacological action of acetylcholine is to decrease in blood pressure. You have to remember that the pharmacological actions that we are discussing right now are all of the IV administered acetylcholine. So M3 receptors, they are present on the smooth muscles and on the endothelial cell lining, the smooth muscles of blood vessels. Injection of acetylcholine will cause vasodilation and ultimately it will lower the blood pressure by an indirect mechanism. So you have to keep in mind that parasympathetic stimulation does not produce any rise of acetylcholine in the blood. So acetylcholine is never released into the blood in significant quantities. So you have to keep in mind that parasympathetic stimulation normally that takes place in the body does not cause any vasodilation. But now when we are talking about IV administration of acetylcholine, that causes pronounced vasodilation and fall of blood pressure by combining with the acetylcholine receptor of the endothelial cells. And now talking about gastrointestinal tract and the exocrine glands, we have M2 receptor present on the smooth muscles of the viscera and M3 on the exocrine glands. So acetylcholine, it actually causes the muscle of the GIT to contract and hence it increases the motility. And in case of exocrine glands, it increases the salivary secretion and also stimulates the intestinal secretions. You can see the pharmacological actions mentioned in this figure. So you have to keep in mind that parasympathetic system is responsible for increasing all kind of secretion. It could be bronchial, it could be salivary, and it could be the gastrointestinal secretions. And in case of the urinary bladder, it causes contraction and ultimately it increases the tone of the detrusal muscle and causes urination. And in case of the pupils, it causes constriction of the pupils, which is also known as meiosis. Acetylcholine is used in the form of 1% solution during the ophthalmic surgery to produce meiosis. And now these are some of the adverse effects observed from administration of cholinergic agonists, that is diarrhea, diaphoresis, meiosis, nausea and urinary urgency. So now starting with cholinergic agonist drugs, first of all we are going to discuss botanical. In case of botanical, it is selective for muscarinic receptors and has a very strong muscarinic activity and lacks any nicotinic action. And as we have discussed that the cholinergic agonists as compared to the acetylcholine, they have longer duration of action because they are not hydrolyzed by acetylcholine esterase due to their structural differences, but it is hydrolyzed by other esterases. So as a result, the duration of action of botanical is about 1 hour. So in this figure you can see M3 receptor, they are present on the urinary bladder, and the major action of botanical is that it directly stimulates this muscarinic receptor, this M3 receptor, and increases the contraction of the bladder, and hence it promotes urination. So now talking about its therapeutic application, botanical is used to stimulate an atonic bladder and also used in postpartum or post-operative non-obstructive urinary retention. So we have to make sure that the urinary retention is not due to any stone in the urethra that has obstructed the passage of the urine. And the adverse effects are due to the generalized cholinergic stimulation. It includes salivation, flushing, decrease in blood pressure, nausea, abdominal pain, diarrhea and bronchospasm. And you have to keep in mind that atropine is its antidote, which is used to overcome the cardiovascular and the bronchoconstrictor responses of this drug. Now the next drug that we are going to discuss is pilocarpine. So pilocarpine and even muscarine and acetylcholine, these are all examples of naturally occurring alkaloids that act as cholinergic agonists. So pilocarpine is actually obtained from a South American shrub known as pilocarpus, and pilocarpine only acts on muscarinic receptor, and that is why it is a selective cholinergic agonist acting only on M receptors. Clinically, pilocarpine is only used as eye drops. So if we compare pilocarpine with acetylcholine, actually acetylcholine, as we have discussed, is water soluble and it cannot penetrate the blood-brain barrier, but pilocarpine, although it is less potent, but it is lipid soluble and can reach CNS at therapeutic doses. Now when pilocarpine is applied topically, it causes the constriction of the pupils by causing the contraction of the constrictor pupillae. You can see in this figure, the first one, where the pupil constrict as the circular muscles of iris contract. So when the circular muscles of the iris contract, it causes constriction of the pupil, and this is parasympathetic activity, and pilocarpine does this to the pupillary muscles. And one very important therapeutic use of pilocarpine is that it is used as a drug of choice for emergency lowering of intraocular pressure of both open angle and angle closure glaucoma. You can see in this figure the difference between open angle glaucoma and narrow angle glaucoma. In case of open angle glaucoma, the issue is in the drainage of aqueous humor due to some sort of blockage, which is usually partial, in the canal of Schlemm. So what does pilocarpine do is that it actually opens this trabecular meshwork around the canal of Schlemm and helps in the drainage of the aqueous humor, and ultimately it causes an immediate drop in the intraocular pressure which has been built due to this blockage in the drainage. And its duration of action starts within few minutes and lasts from 4 to 8 hours. And one more important thing is that although because this drug is not selective, so that's why it's not used systemically, because it can induce secretions, and it is one of the most potent stimulators of secretions such as sweat, tears and saliva. Now in patient with xerostomia is a condition in which the patient does not produce saliva, or we can say it is a condition in which there is dry mouth. So pilocarpine is also used to stimulate salivation in such patients. And there are some patients who suffer from Jorgen's syndrome, which is again characterized by dry mouth and lack of tears. So in that case, oral pilocarpine tablets can be used to induce or stimulate secretions. But we have to remember that there is a drawback of being non-specific, because when this drug is taken, it's going to stimulate all kinds of secretions in the body. The adverse effects of pilocarpine topically on the eye is stinging sensation, and it could also cause blurred vision. And you have to remember that poisoning with this agent will result in the cholinergic system stimulation, and that will include profuse sweating and stimulation of all kind of secretions in the body. You have to keep in mind that students, the adverse effect of the parasympathetic agents will be overstimulation of the parasympathetic system. And the antidote of pilocarpine is atropine, because atropine is also lipid insoluble and it can also cross the blood-brain barrier, and it can reverse the toxicity of pilocarpine that has been introduced in the CNS and in the system.